Uh, like, like Shannon said, my name is Kacee Redden, and I am the Tobacco Disparities Coordinator for the South Dakota Department of Health Tobacco Control Program, and I am located in Sioux Falls, South Dakota. I will be your speaker for today, and I will be focusing on the South Dakota QuitLine, other cessation resources, and how to put this knowledge into practice with different pilot projects that I am currently overseeing. Please note that during today's presentation, the term tobacco refers to commercially produced tobacco products only, and never the traditional tobacco of the Northern Plains American Indians. This slide gives us an overview of my presentation today. We'll touch on the toll of tobacco, explain our priority populations, take a closer look at the South Dakota QuitLine and its services, talk about making referrals and how to promote the South Dakota QuitLine, and I'll share some resources and tell more about our pilot programs we have. But first, we will kind of give a little educational component here. So tobacco use still remains the leading cause of preventable death, disability, and disease in the United States. It kills over 480,000 people in the US each year. In fact, tobacco kills more than HIV and AIDS, illegal drug use, alcohol use, car accidents, murder, and suicide combined, and more than likely the underlying cause of their health issues. The cost of tobacco doesn't just affect those who use it. It affects all of us. South Dakota pays more than $373 million annually in tobacco-related healthcare costs and $282.5 million in lost work productivity. This breakdown to each household pays $782 in taxes to cover those tobacco-related costs, whether they use the products or not. South Dakota's smoking rate is above the national average at 18.3%. In South Dakota, tobacco use causes 1,300 deaths each year, which equates to over 3 people each day. Smoking causes damage to every part of the body and organs of the body. 13 different types of cancer, respiratory diseases, and cardiovascular disease. So as you can see in this picture, pretty much everywhere it touches, you can cause risk for damage. Secondhand smoke is smoke that comes off the end of the smoking cigarette and the smoke that smokers exhale. 41,000 people die each year from secondhand smoke. As you can see, secondhand smoke causes numerous health problems in adults as well as infants and children. Secondhand smoke is the combination of smoke from the burning end of a cigarette and the smoke that is breathed out by smokers. Secondhand smoke contains more than 7,000 chemicals, of which hundreds are toxic and about 70 can cause cancer. Thirdhand smoke is the residual smoke that lands on surfaces after the smoker has stopped smoking. It can be left on hair, clothing, and other surfaces. People are exposed to the same toxins found in tobacco smoke when they ingest thirdhand smoke. This is especially dangerous for infants and children. Babies put everything in their mouths, crawling on the floor and furniture, and ingesting these toxins at much higher rates than older children or adults. It cannot be eliminated by airing out the room, opening up windows, using fans, etc. And this is one of the reasons why a lot of public health places will say, like, don't be smoking in your cars, because even though you have the air or the window open and air's coming in, that thirdhand smoke is still being found in the material inside the car. Spit tobacco is not a good alternative for smoking either. Both products contain nicotine, which is harmful and addictive. Smokeless does not mean harmless. This is the same as nicotine addiction, but there's a different route. There are 28 carcinogens present in spit tobacco, and spit tobacco users are 50 times more likely to be diagnosed with oral cancer. Like smoking, it narrows the blood flow and can cause heart disease and stroke. It can actually be harder to quit as well. The South Dakota QuitLine is just as effective for spit tobacco users as it is for smokers. E-cigarettes continue to be a growing problem. Still a lot of questions. Many studies are currently being in progress because of this, which is going to take time for solid results. But what we do know is that the vapor is not just water vapor. There are different levels of nicotine and other harmful substances. The FDA regulations are in the works, but right now there's no way to know what is in the e-juice exactly. The e-juice is what they put inside the vape that has the nicotine in it. We do know that the devices are not safe for youth or pregnant women. They are not safe for those who don't currently use tobacco products, since we don't know the long-term health impacts of e-cigarettes. But we do know that they are similar to cigarettes. They are not an FDA-approved cessation device. However, the FDA is looking into the effectiveness. Our South Dakota QuitLine data shows that e-cigarette use hinders the quit process and create dual users. Dual users means that they are using more than one nicotine product. So, for example, e-cigarettes and the commercial tobacco cigarettes that we see, or it could be that they're using the spitless tobacco and e-cigarettes. Thankfully, our South Dakota QuitLine has several other effective cessation options available. There is also danger of explosions of these devices. Some people have lost teeth, gotten second-degree burns to the face and neck, and have been pulling chunks of plastic, teeth, and foreign objects from their mouth, throat, and lips. Even though tobacco use rates are slowly declining among the state's population overall, the rates are still troubling among several groups who are disproportionately affected by tobacco. Tobacco-related disparities can affect population subgroups based on factors such as age, income, mental health status, race or ethnicity, sex, and substance abuse conditions. In addition, there are other groups for whom there is potential for significant positive gains by investing in tobacco control. These are the populations that use the devastation of tobacco more greatly. There are also those that tend to be less likely to quit and are targeted by tobacco companies. Our South Dakota priority populations include American Indians, people with behavioral health conditions, people of low socioeconomic status, pregnant and postpartum women, and youth and young adults. South Dakota's American Indian populations experience substantial tobacco-related disparities. Commercial tobacco use is more than double in the state's American Indian adult compared to the overall statewide rate of 43.6% compared to 18.3%. American Indians also start using tobacco products at an earlier age than the general population. People with diagnosed mental health conditions or substance use disorders are disproportionately affected by tobacco as well. Nationally, nearly 1 in 4 adults have some form of behavioral health condition. And in these adults, they consume about 40% of all cigarettes smoked by the adults. In South Dakota, approximately 18.1% of the population has been diagnosed with mental illness. Of them, 40.8% smoke compared to 23.2% of people without diagnosed mental illness. Significant tobacco-related disparities exist for low SES or socioeconomic status populations. In fact, socioeconomic status, which is a combination of education, income, and occupation, is the single greatest predictor of tobacco use. South Dakotans with lower income use tobacco at higher rates than the general population. This is in part because the tobacco industries increase their advertising in low income areas, so community members face more exposure to tobacco marketing. Reducing tobacco use among pregnant and postpartum women is critical to ensuring healthy babies, and families. The rate of adult pregnant women currently smoking in South Dakota is 11.8%. And South Dakota also has a 5.9% infant mortality rate. Youth and young adults ages 18 and under for the youth and 18 to 24 for young adults are an important population to be considered. Nearly 9 out of 10 cigarette smokers first tried smoking by the age of 18, and almost all first tried smoking by the age of 26. Smoking prevalence among South Dakota's high school students is 12.8%. Approximately 300 of South Dakota's kids become regular smokers every year. Nationwide, youth e-cigarette use has increased dramatically in the past few years, with about 25% of high school students and 10% of middle school students reported e-cigarette use in 2019. So this is just some information on our South Dakota QuitLine. We offer a variety of services, which include free cessation counseling, where participants can get up to 12 coaching calls if needed. Another perk is that they can receive free nicotine replacement therapies, such as the patch, lozenge, or gum, or cessation prescription medication, which could be like generic Zyban or generic Chantix. Participants can receive up to 12 weeks of the nicotine replacement therapies or cessation medications, as long as they're participating in the coaching calls. Another South Dakota QuitLine service is our Kickstart kit, which is a self-help option that includes up to 4 weeks of nicotine replacement products and a quit guide. Individuals can enroll through phone, web, or fax referrals. To be eligible for the South Dakota QuitLine services, a person must be a South Dakota resident. They must be a tobacco user, and that does include e-cigarette users. They have to be 13 years of age or older. They have to be a current tobacco user or has quit in the last 30 days. Because we know that quitting takes multiple times for success, people are able to enroll twice per rolling 12-month calendar year. So that means that if you tried quitting in December of this year, and then you lapsed in February of 22, you would actually be able to receive services those 2 times, and then it would start over in December of 2022. As mentioned before, participants are now eligible for up to 12 weeks of coaching calls if they're needed for that. And these are really easy to set up. The coaching sessions center around a quit date. They develop a quit plan. They set the date, discuss what kind of medications or nicotine replacement products that they're wanting, their coping strategies, triggers that they might have, and any withdrawal symptoms that they've been going through. The QuitLine coach calls the participant at a scheduled time that they have worked out, and these are highly trained individuals that are in cessation and addiction. There are a few options the QuitLine participant and coach discuss. Participants can choose the free prescription medication, or they can choose the free nicotine replacement therapy, including the patch, gum, or lozenge. No prescription is needed for the nicotine replacement products unless they are under the age of 18 or pregnant. Once enrolled, the QuitLine will fax the prescription form to the provider to fill out, which they fax back to the QuitLine or do an electronic prescription. If they produce documentation from their healthcare provider of an adverse reaction, we will allow them to switch medications. To receive medications, participants must enroll in the QuitLine services, participate in coaching calls. Then the medications are mailed directly to their house. And with needing a prescription for being under the age of 18 or pregnant, this is just to make sure that the doctor agrees that it would be the best route for that individual, especially with pregnant women. Under 18, they the ages 13 to 18 that they can receive the services, but they have to have a prescription. And not necessarily do they have to tell the parent, the doctor just has to agree that that is a prescription that they need. The South Dakota Kickstart program is for people who are ready to quit, but not quite ready to enroll in our phone coaching program. Participants can get the nicotine replacement Kickstart kit and the Quit Guide, or they can just receive the Quit Guide. They're both free and they don't have to enroll in the QuitLine phone coaching program to get them. People are simply go to our southdakotaquitline.com/kickstart to request their free Kickstart kit. Of course, these folks can also enroll in our free full service South Dakota QuitLine phone coaching program anytime they want. We now have the option of a 2 or 4 week option of nicotine replacement products. But in order to get the additional 2 weeks of the nicotine replacement therapy, the participant must agree to have a short coaching call to see how things are going for that participant and to confirm their mailing address as well. About half of women who quit smoking during pregnancy relapse 6 months after delivery. 80% of relapses happen within 12 months. We offer additional support to pregnant women during and after pregnancy with our postpartum program, which we refer to as P3. In addition to the 5 regular coaching calls, pregnant women who quit using tobacco during pregnancy can receive up to 4 relapse prevention calls and gift card incentives. They are also able to immediately get re-enrolled in standard coaching if relapse has or does occur. Women can have coaching on their own or utilize the QuitLine to quit while pregnant to be eligible. So, to be eligible for the South Dakota QuitLine services, a person must be a South Dakota resident, a tobacco user, including e-cigarettes, age 13 years or older, wanting to quit in the next 30 days or has quit in the last 30 days. And because we know the quitting takes multiple times for success, people are able to enroll twice per rolling 12-month period. We like to think of the South Dakota QuitLine as the Cadillac of QuitLines. We actually have one of the top QuitLines in the nation. It is unique by providing free counseling and free cessation medication to all participants. Other QuitLines only offer some meds or coaching to certain people. The South Dakota QuitLine is evidence-based, which means research, data, and evaluations are done on how services are delivered and how successful the QuitLine is. And this is just our comparison of the QuitLine rates from our 2019 data. So South Dakota rates were at 38.6%, and the US quit rate was an average of 31.5%. Healthcare providers are the QuitLine's #1 resource of QuitLine referrals. There are several ways to connect tobacco users to the South Dakota QuitLine. You can call the QuitLine with a patient or give them a QuitLine business card or a brochure. Other option is the web referral, where the patient will fill out forms online and then the QuitLine will call them back the next day to enroll them. A direct referral is the fastest and most successful way to connect your patients to the QuitLine. This can be done with a fax referral or through a EHR referral, which can also be called an e-referral. Once the QuitLine receives the referral, they contact the patient. By doing this directly in your office, it doesn't allow the patient to delay treatment. A direct referral also is the only way the QuitLine can provide feedback to you, whether they enrolled or not. If your facility does not currently have the EHR referral capabilities and would like to be interested in adding this feature, you can email me or contact me, and I would be happy to help assist your facility in that, stepping into getting that started. On the right-hand side of the slide is actually a list of health systems that can currently have e-referral capabilities as well. Regardless of your specialty, you can use the 2 A's and an R method, and double your patient's chances of quitting. Or if you're not seeing patients, you are like in a classroom or something like that, you can still use this reference point. So the first one is ask. So it doesn't hurt to ask. Most tobacco users want to quit, and every year about half of them try and fail because they're not getting the help that they need when they make their quit attempt. So all you have to do is just ask, do you use tobacco? Ask about tobacco use every visit. If they're coming in for help or if they seem stressed out, you can ask them, can we talk about your tobacco use today? Or what are your thoughts about quitting in the next 30 days? Or would you like for you to quit smoking or chewing? The second A is advise. Use your knowledge and skills in a personable and non-judgmental way to advise the quitting is the single best thing that you could do for their health. Oh, sorry. There must be someone out there. Sorry about that. The mailman came. So the advice portion is so once you have advised on their quitting, like I think you should make a quit attempt, patients or individuals can kind of think about it themselves. But most of the time, if you're not supportive or you're kind of judgmental, it might kind of deter them from even reaching out. So it's important to come in a caring and non-judgmental way. The next one is R, refer. If willing and ready to make a quit attempt, refer them to the South Dakota QuitLine and educate them on the South Dakota QuitLine. There's a great resource for all South Dakotans. And this is designed to help your patients quit tobacco. If unable, have the conversation, make sure materials are available in the waiting room, patient rooms, out in the open, just so it is kind of an opportunity for a passive way for them to see the options of the South Dakota QuitLine. So other cessation options are our smoke-free text, which is the national ones available. There is also one for teens that are ages 13 to 17. And then there's Kickstart app, which is a smartphone app to help you quit smoking as well. Some more this is Quitting, and this is by the Truth Initiative. And they are aiming this one at young people to quit vaping. There is also a program called In Depth, which is an alternative to suspension or citations that will help address teen vaping. This is part of our state plan for our tobacco control program. And so for these goal areas, we actually have put in to focus on tobacco cessation, in particular to our 3 different strategies. So that's just a little overview of ours. The PROF is an online training program designated to educate and answer any questions that you may have about the QuitLine to help patients on their free journey to become tobacco free. This is an easy online training course that you'll learn about the effects of tobacco and the steps required to help those addicted that are seeking help. You'll also learn how to visit with your patients about tobacco use and refer them to the tobacco QuitLine. And that is using the 2 A's and R approach. Other PROF topics include the toll tobacco has taken on South Dakota, priority populations, talking about tobacco techniques, services of the South Dakota QuitLine, and tobacco and chronic disease. This training is free and can be done on your own time and at your own pace. You just have to go to www.dohprofsd.org. The South Dakota Tobacco Control Program has many free resources available for ordering through this website. This is where you'll find South Dakota QuitLine brochures, business cards, etc. And they're all absolutely free. This is what our South Dakota QuitLine looks like when you go to the website, and that is sdquitline.com. So now I will discuss our pilot projects that we've been working on. So our vision for the tobacco control program is all South Dakotans will enjoy healthy lives free from the harms of tobacco. Our mission is enhance the quality of life for all South Dakotans through prevention and reduction of tobacco use and exposure. The first pilot project that I am going to talk about is our behavioral health pilot program. And this started in December 2020. So individuals diagnosed with mental illness in South Dakota is at a rate of tobacco use of 40.8%. Low-income communities are targeted by the tobacco companies. Adults who live below the poverty level have less success in quitting than those who live at or above the poverty level. Individuals with a behavioral health condition consume almost 40% of all cigarettes smoked by adults in the US. We used to only focus on Medicaid clients as it is easier to gain data from them, but we have expanded to include our low socioeconomic status individuals because there is a need in the area that have not been reached as much. So this pilot program started out as a low socioeconomic status pilot project, but as we started going through, we saw that there may be a need for behavioral health. And so this is a warm referral process to the QuitLine services. And so currently, to receive nicotine replacement products from the South Dakota QuitLine for free, an individual must provide a valid address where they live. If the address is a community living area or group home, the requests are not accepted as valid addresses, as the nicotine replacement products cannot be guaranteed to get to the client who ordered them. Since we are working with clients directly on medication management with Southeastern Behavioral Health, who is having our pilot project done there, this was an opportunity to get a client set up with QuitLine services to be sent directly to them. So due to having to have a valid residential address, individuals living in unstable housing or group homes do not qualify. Our goal for this is to use medication management caseworkers at Southeastern Behavioral Health as liaisons for receiving the nicotine replacement therapies on behalf of the client. The caseworker would then help the client sign up online for the Kickstart kit and put the designated address in for shipping to receive on behalf of the client. So that's kind of the process shown there of maybe they're in a unstable housing or in a group home and they can be referred to the QuitLine, then the caseworker will receive it on their behalf. This is where we kind of set it up differently for providers. So first, they would put in the client's name, and then they would put Southeastern Behavioral Health's address, and then they would put in the client's information. And the last important part was the caseworker's name. And so this is how we can guarantee that the client will receive the product. It will be sent to their caseworker, and then the caseworker would give it to the client. Some challenges in this pilot are the time frame that we started the medication management pilot program. So this pilot started in December 2020 with Southeastern Behavioral Health. And as we all know, due to COVID restrictions, Southeastern Behavioral Health was not meeting clients in person either. So we were not able to enroll in the exact program as it was first pictured. So the low socioeconomic population is difficult in this particular situation as well. And they have other immediate needs that were in the hierarchy higher than stopping smoking. So we actually moved to our next steps, which is what we learned from this pilot, was that instead of focusing on low SES population, we worked with the behavioral health population. So our focus is on the inpatient / residential facilities for behavioral health instead of just the low SES. And we'll be moving forward on getting at least one more behavioral health inpatient or residential facility to be involved in this pilot project as well. Luckily, Southeastern Behavioral Health was a fit because they also are working with behavioral health population as well as the low SES. So it just was a nice transition there. Looking at adding other behavioral health facilities is what we're working on next as well. Our next pilot project is the Correctional Facility Pilot Project. And this started in August of 2021. Individuals diagnosed with a mental illness in South Dakota is at a tobacco use rate of 40.8, which we already know. And we also know that low income communities are targeted. So we actually found that people that were in the correctional facilities kind of fell into both of these populations. So they could fit in that low socioeconomic status and also behavioral health at times as well. So we actually are using the same warm referral process that is with the behavioral health pilot. And we saw that there was a need for cessation services for individuals that were incarcerated. Currently, you still need to have a valid address to prove of your residential status in South Dakota. And so it just made sense to use that same behavioral health process for the correctional facility. The only thing that is a little different about this is that the jail administrator will receive the nicotine replacement product on behalf of the client compared to the medication management caseworker. Studies have shown high rates of current or former smoking among individuals incarcerated in the US prisons of all ages, with prevalence estimate typically ranging from 60% to 80% compared to the 15% of non-incarcerated adults. Smoking prevalence is about 4 times higher in criminal justice populations than in general population. To help decrease commercial tobacco use and behaviors due to nicotine withdrawal, the South Dakota Tobacco Control Program is piloting in the Falk County Jail. Since inmates come in and complete a survey with the jail administrator, this will be an opportunity to get the client set up with the QuitLine services to be sent directly, have the NRTs directly sent to them in the jail. As of August 9th, 2021, we started a pilot for this correction facility. And this is in Falk County in South Dakota. And the reason that we picked this county jail is because they were actually a letter of support for one of the community school partnership grantees, which was the Faulkton Medical Center. And so it just made sense that they supported the Faulkton Medical Center projects in Faulkton to see if they would be willing to have the connection there in their county jail. And luckily, I had the opportunity to connect with both the sheriff and the jail administrator. And it was an opportunity to kind of join forces and start something new that South Dakota hasn't really seen in our jail population. So we were all very excited about it. And we've been using the same process as with Southeastern Behavioral Health. And in just the first month, we actually received 7 referrals, which doesn't seem like a lot of referrals, but that county jail is in a town of less than 800 people. So that is actually quite a large amount for that jail to be bringing in. The next steps and what we have learned from this pilot so far is that we are looking at how we can connect and improve our services with the clients that are incarcerated. One factor is that we really want to cut down on those withdrawal symptoms. This is a complex pilot and may have more needs due to the environment. So we'll be doing evaluations with both the staff and the clients. And we do evaluations with all of our QuitLine enrollees. And our next step is to see how maybe we can expand this process to another location. Our third is the Canli initiative to empower South Dakota tribes. The South Dakota Department of Health Tobacco Control Program and the Missouri Breaks Industry Research, Inc. have collaborated to offer a new opportunity. Together, we hope to combat commercial tobacco use and reclaim traditional tobacco practices in American Indian populations in South Dakota. This initiative was developed due to the 42.3% of American Indian adults that currently smoke in South Dakota, which is more than double the rate of all races. A majority of South Dakotans are protected from secondhand smoke due to the state public smoke-free air laws in all indoor public places. However, residents living on sovereign tribal nations may still be exposed to secondhand and thirdhand smoke in public places since South Dakota's laws do not apply. With this initiative, Ray O'Leary and Corrine Huber from the Canli Initiative Coalition and Kacee, Redden, myself, and Tynell Milliner from the South Dakota Tobacco Control Program envision improving health equity efforts using the Canli Coalition's framework in the South Dakota Tribal Tobacco Advocacy Toolkit. This team will support tribal tobacco partners in South Dakota. South Dakota has 9 reservations in which one reservation has successfully passed a comprehensive tribal smoke-free air ordinance. Research indicates smoke-free laws encourage cessation for current smokers and discourages youth initiation. 2 mini grant opportunities of $5,000 each were available to fund tribal tobacco events and activities. The awarded grantees were notified in November. 3 mini grant opportunities will be available for applications again in May 2022. So further communication will be provided at a later time about these opportunities. We will be in collaboration of creating assistance guides on tribal approval process, data collection and sharing, and developing questionnaires or surveys for collecting data. The South Dakota Tobacco Control Program and Missouri Breaks Industries Research, Inc. are excited for the partnership to increase health equity and decrease commercial tobacco use in Native American populations in South Dakota. I will pass it over to Ray, if she is on, to kind of share a little more information about the mini grants.
Sure, thanks, Kacee. So yeah, like Kacee said, we've been able to provide 2 mini grants so far. They were just announced this past November, and those will be going to the Lakota Youth Development, which is serving the Rosebud and Yankton Sioux tribes, as well as the Teoshpazina School located on Sisseton Wahpeton Oyate. We're very excited about working with them and supporting them in the work that they have planned to do. They're $5,000 mini grants, so each of the locations that received one of these is doing kind of one main event or activity with their community. And in the future, we hope that these mini grants, we kind of build capacity and give an opportunity for people to just get their feet wet in what this work is like, and eventually apply for bigger grants so they can do more eventually in their community in regards to commercial tobacco prevention, as well as promoting the use of traditional tobacco in their communities. So to do that, there's it's not just the mini grants that come with this, but also we just provide kind of some technical assistance if there's tribes that want to get started and they're not really sure where to start. We're here to help. If there's tribes maybe that are already on the journey of working in the area of tobacco and hit some roadblocks and need help to just troubleshoot what those roadblocks are, we're here for that as well. And then we also are promoting the Canli Coalition's Tribal Tobacco Toolkit, which I'm putting in the chat box right now. And this is kind of it turned into a website that uses the Canli Coalition's framework for tobacco policy and education. And it's something that has tons of tools and resources and examples and hints. And it's kind of a place to go if you're not sure where to start, or you're just looking for one specific resource. There is a search box in there. There's also some videos that you can check out that have kind of a how-to, and there's some links to resources to get connected to others that are doing equally great work in other areas. So yeah, I guess that's kind of the background on the Canli initiative, and we're here to help. You'll find my information as well as Corrine Huber's on the link that's in the chat box. If you have any questions, you can follow up with us through that contact information. Thanks, Kacee.
Thanks, Ray. And now I will kind of address any questions. Here is my contact information if you want to give me an email or give me a call. I try to be pretty on top of everything, so I will answer any questions if there are any.
Thank you, Kacee and Ray. Just a reminder, if you do have any questions, you can put them in the chat box or the Q&A box. And I do have one question in the Q&A for you, Kacee. In regards to the correctional project, are you going to be tracking the tobacco use and/or relapse of the inmates upon their release?
So with that, we haven't changed any of our tracking system from our regular QuitLine services. We continue to do like monthly, like a follow-up 3 months after and 7 months after to see if they're still tobacco free. Obviously, it's off from the number that they gave us for reference. And so if they don't answer or it's disconnected, we do not get that information, but we've been trying to keep track of that in a timely fashion. And also with our correctional facility, the jail administrator typically knows how long that they're going to be there for. So if they're going to be there less than the 2 weeks, they will still offer the QuitLine services through the Kickstart kit through that process, but it will actually be sent home to the address that they call home instead of to the jail. So that's another opportunity that we're getting them set up with services when they get home if they're there less than that 2 week period.
Great, thank you. I'm not seeing any other questions coming through at the moment. Ray, would you like to say something?
Yes, thank you, Shannon. I forgot to mention one thing on the Canli initiative. We do have a listserv that we have gathered tribal tobacco partners in South Dakota. We have a few that are outside the state that we welcome as well if you're not necessarily within South Dakota. But what we do with that list is send out just maybe 2 to 3 emails a month that have a variety of resources, webinars, funding opportunities, any learning and sharing that we can do to just kind of keep in people's inboxes and funneling good information to them so they can take advantage of all those opportunities. So I'll put my email here in the chat, and if anybody is interested in being added to that email listserv, you can send me an email and I'll get you added. Thanks.
Great, thanks, Ray. There also in the chat box, there is a link to our evaluation form, just a quick feedback form. We appreciate everyone's thoughts and comments and feedbacks on our webinars. So if you could please fill that out before leaving today, we greatly appreciate it. I would just like to say another big thank you to our presenter, Kacee, and Ray for jumping on today and providing this wonderful information. We appreciate your participation and your information. Again, this webinar has been recorded. You will all be getting a follow-up email with the link to this webinar and the slides. I'm not seeing any other questions, so thank you all again for joining us today. Thank you to our presenters, and we hope you have a wonderful day and a great holiday season. So thank you, everyone.